fascinating subject once you start looking into it. What we can see from the Atlas is that there are significant variations in healthcare between different Australian places and clinical settings.
The objective of it is to see whether we are providing Australians with access to the right care at the right time in the right place.
I think the most important thing from the Atlas is that, first of all, it gives us an outline of what's happening right across the country. This is the first time I think we've been able to look at the whole of Australia in the level of detail. From that, we can actually then begin to look within areas for comparisons to see whether things are similar or different and the degree of difference between the various areas.
I think the Atlas has really highlighted some unexplainable differences for us, but it has also highlighted areas where we clearly can see what we need to do better.
And I think the way it was framed is that this is the first time we've actually been able to gather data from various sources and start to look at, what does it mean, and can we explain the variation? Are there areas in Australia where people aren't getting access to care? Are there in fact clinical decisions being made that are different in different places, or is it the way that we actually get access to services?
I think it's important in interpreting the access to think about what variation means. Variation is the core of good clinical practice. Personalised care means that you get the care that you want, that you can discuss and choose. There's other variation which is understandable variation. It's where the person may not have the access to the option they want for treatment, and there might be good reasons for that, and then the variation is to adapt for that.
The next steps are for everybody in the country at all levels, all of them taking ownership of this problem and trying to work towards what we call stewardship of antimicrobials, which is to get better antibiotic prescribing, the right antibiotic prescribing to those who need it, and no antibiotics to those who don't.
Part of the process has been to sit down with all the stakeholders and say, well, okay, this is what it looks like. We know where we want to get to. What have we got to do to get there? So you'll see there's more than 60 recommendations, and the purpose of those recommendations is to really start to articulate the sorts of things that need to happen at all levels of the system so that we can move forward.
In the immediate future, this Atlas will be very helpful to the new primary health networks in every part of Australia. The networks, or PHNs, are developing their work plans, and they will have the ability to commission health and medical services to fill gaps and encourage better coordination of local services to meet the needs of local people.
I think that the Atlas poses a lot of questions. It gives us a lot of thinking material and a lot of ideas that we need to take forward to continue to improve the quality of the care that we deliver as a profession.
I think the Atlas is an amazing first step on a very long journey to improve the quality of healthcare in Australia.
Well, the next steps is actually starting to work with our clinicians and consumers, bring things down to a more granular level within each of the states and territories, and start to work with people to unpack the reasons why the variation exists, and then identify the actions that need to be taken at that local level to improve the care for the patients, and then monitor those changes and ensure that those are leading to better outcomes for our patients.
We need to measure outcomes, because the objective of the Atlas is to improve outcomes. Right patient, right care, right time, so they have a better outcome.